Every participant has a right to refuse medications. Staff need to ensure the participants' rights are observed regarding medication administration. If a participant refuses a medication, you need to inform the team leader or the person on call and make sure that you document that and the reason for a refusal in the progress note. If a participant refuses a medication, then maybe you can come back later. If you come back in 30 minutes' time, they may accept that medication. If they continue to refuse the medication, then an incident report must be completed. If a participant regularly refuses a medication plan must be completed and the doctor must be notified. Respectfully, we can refer to the participant declining medication instead of using the word refusal. Participants may also be ordered what is called PRN medication. PRN stands for pro rata nata, which is a Latin word which means as the circumstances arise. PRN medication is medication that's taken only as required or as needed, and it must be prescribed by the medical practitioner for specific signs or symptoms. The PRN medication must be signed for exactly the same as all other medication and as administered. If you have given a PRN medication, then you must document the effectiveness of that PRN medication. Did it work as it was intended? The PRN medication order must have the reason why it has been ordered, the dose, including the maximum daily dose, and the frequency. PRN medication should be packed in a different colour Webster pack, usually a white Webster pack, to ensure that staff are aware that it is not a regular medication. If the PRN medication is linked to a restrictive practice, so an approved PRN chemical restraint, staff must seek approval for the administration of that PRN before they can administer it. Staff are to closely monitor the participant and keep the team leader or on-call staff up to date. And remember that this PRN is always to be used as a last resort. All other strategies in the behaviour support plan must be implemented if the behaviour continues to escalate. Schedule 8 drugs are those substances that are potentially addictive and therefore are limited. Extra care should be taken when assisting participants with S8 medication. At all times, the GP orders and medication sheets must match the Webster packs or unpacked items supplied, and orders must be followed, ensuring no overdosing, errors or misuse of any drugs. Any issues must be reported. There is an additional count book which is used to document S8 administration in some of our services. When the quantity of tablets reduces, it must be verified against the medication chart, and the S8s should be packed in a purple Webster pack. S8s and other multi-packed medications, if in a dose pack with a client name on it, can be self-administered as it would be in their own home if the participant is deemed competent by their GP. If staff notice that an S8 medication is missing, then the staff are to fill in a police report and notify their team leader or the staff member on call. Staff are to document this event number in a Quasar incident report. S8 drugs must be checked once per day at a minimum. Ideally, S8 drugs should be checked once per shift and verified by 2 staff members during handover. This is to be documented in the S8 sign sheet and reviewed by the supervisor or delegate. The following should be checked: the quantity of tablets on hand, administered and number of tablets supplied and documented in account previously, tablets appearing damaged or incorrect, blister packs being popped out on an incorrect date or time. Signs of tampering will need to be looked at carefully to ensure blister packs are appropriately sealed around the edges. Any errors or discrepancies must be reported to the supervisor or the on-call staff immediately, and a quasar report must be completed as soon as practicable by the staff member. For all Schedule S8 drugs which are reported missing, a police report must also be made. Methotrexate and cytotoxic drugs are drugs which work by causing the death of certain types of cells and are used to treat conditions such as cancer, rheumatoid arthritis, multiple sclerosis, and some ophthalmic conditions. Not all drugs prescribed for cancer are cytotoxic. They will be packed into separate purple Webster packs marked with the cytotoxic symbol, and the cytotoxic precautions to be followed must be used for participants who require administration or assistance with their medications. So what precautions should you take? Cytotoxics must not be packed with other medications. Oral cytotoxics must be supplied in a separate dose administration aid, in purple colour. Topical cytotoxic agents must be stored separately to all other topical treatments in packaging that alert staff to the product being cytotoxic. Any staff administering cytotoxic medication in any form must read the product information carefully and pay attention to administration procedures and precautions. Cytotoxic precautions are required if staff are handling cytotoxics, including required personal protective equipment. Staff who are pregnant must not be exposed to cytotoxic medication. Any residual cytotoxic materials, including gloves, body fluids, fecal products or continence aids, are considered cytotoxic waste and must be disposed of safely. Disposable purple cytotoxic gloves must be worn by staff when administering cytotoxic medication. If purple cytotoxic gloves are not available, then staff need to apply 2 pairs of disposable gloves. The gloves and medication cup used are to be disposed of by placing in a plastic bag within another plastic bag and placing the bag in the general waste bin. The label on cytotoxic medication must show a warning label and handling instructions. The pharmacy must be notified if a cytotoxic agent, whether oral, injectable or a cream or ointment, is not labelled correctly. The product must be returned to the pharmacy for relabelling prior to the time of the next dose or application. Medications must be stored in a locked cabinet or special purpose lockbox. The medication cabinet or box must have the medication management poster displayed to identify it as a participant medication box or cabinet, and the box must be locked when not in immediate use. All medication is to be pre-packed into a Webster pack except for creams, drops, ointments or other non-tablet or capsule medication. When a participant is managing their own medication, they should be secured in a place that is not accessible to other people or participants preferably in a locked box or drawer. Medications that are administered by uniting staff must be stored in the locked cabinet, except when in immediate use, dispensed in blister packs where possible and stored together in a cabinet or room. They need to be stored in a way that ensures it is separate from other participants' medication and documentation. They need to be numbered where a participant requires 2 or more blister packs for any reason. The temperature required for storing a drug is shown on the manufacturer's label, and additional advice about storage can be sought from the pharmacist. Most drugs should be stored below 25 degrees Celsius, and some need to be stored in the refrigerator. Those that require refrigeration must be stored separately from food to avoid contamination. Disability accommodation services medications requiring refrigeration must be stored in the fridge located in the staff office. In the community, if medications are stored in the general household refrigerator, they must be secured to prevent people from accessing the medications belonging to others, or from taking their own medications before the due dosage time. When out and about in the community, staff should take the full Webster pack with them in a locked bag or backpack. Where this is not possible, and for non-Webster packed medications, such as creams or eye drops, medication should be stored in a single dose container that clearly states the participant's name. When packaging a medication container, all the same precautions that apply to assist with medications, including the 6 R's, also apply. The lock bag or backpack and the key for the lock should remain with the staff member at all times. Do not leave the bag or backpack in a vehicle unattended or with a participant. When attending a medical appointment, health appointment sheets are required to be filled in. Take the participant's medication chart and Webster pack in case there are changes made to their current medications. The doctor is to fill in the reverse side of the health appointment sheet and sign it. The doctor is also to sign any changes that are made to the medication chart. Repeat prescriptions are requested for pharmacy as needed. The Webster pack is taken to the pharmacy with scripts for any medication changes. The health appointment sheet is to be signed by the team leader and scanned into CareLink with any reports or referrals which have been made for the participant. When you are administering medications, you must observe the participant while they're taking their medication. You will need to observe them for a short period afterwards to note whether they have had any reaction to the medication. Swallowing safety needs are to be raised for new clients into the service to have a nutrition and swallowing risk checklist or client plan completed. You need to interact with the participant and talk to them while you are assisting them with their medications. Always consider how you would like to be treated if you were the participant and apply the same principles. Provide help when needed or if asked. If they don't like the taste of the medication, you may be able to offer them something to eat or drink afterwards. You must check with your team leader or the person on call. If you suspect that they haven't swallowed the medication, have a chat with them or ask them to have a drink. If you're worried about any interactions with the participant in regard to the medications, then you must talk to your team leader or the person on call. You need to monitor for any changes in the participant. Some things to note with medications include whether we need to observe for that the participant has actually completed taking the medications. As we have already stated, a participant always has the right to refuse to take their medications, but we need to make sure that we're aware of that we document that and we report it. All reactions to medications need to be documented and reported. Should the reactions need immediate attention, then you must call 000 for an ambulance. These immediate reactions may include drowsiness, lethargy, pain, constricted breathing or choking, hot, clammy, feeling unwell, feeling dizzy. You should seek help if they have an allergic reaction, if swallowing difficulties have been identified, if a participant has nausea or vomiting or is feeling generally unwell, if they've refused medication, or if the participant is unusually confused or disorientated. If you have any concerns about the participant, you may need to stay with them and observe them for a longer period of time. You may also need to return to check on them after you've completed assisting other participants with their medications, and then report that to your team leader. You need to be aware of the medication posters, which are inside the medication cupboards in the staff areas, which are there as prompt sheets to ensure that you're doing the right thing when you're administering medications. So as a summary checklist in regard to administration, you need to wash your hands, clarify what assistance is required, check the details including the person's name, date of birth, allergies, correctly identify the participant, greet and prepare them for the medication, recheck the medication, observe the state of the participant, report any changes or reactions, and document and record anything that you have done. What is a medication incident? Any event that may cause or lead to inappropriate medication use should be reported and recorded to your manager and into Quasar. These can include the wrong dose, the wrong participant, the wrong strength, time or route of a medication, incorrect administration, failure to sign a medication chart, an incomplete order written by the doctor, a pharmacy packaging error, a missing medication, medication found on the floor. It could also include not being able to read a medication order, medications that have expired, an incomplete order, or damaged medication packaging. All incidents are to be reported to the team leader or the person on call. They need to be documented in progress notes and complete a Quasar report. You need to monitor the participant for any adverse outcomes of a medication incident and document those. If packaged medication is refused or not given for any reason, it must be discarded or sent back to pharmacy. Unopened packs are sent back to pharmacy. Open packs may be disposed of in a sharps container. Medication records need to be treated in line with Uniting's privacy and confidentiality policies. Many documents, including medication charts, support plans and medication sign sheets, contain personal information about the participant, including their name, date of birth, their diagnosis, treatments, and other possibly sensitive information. Never leave participant files in common areas and always store them in the appropriate areas in the office. If you have any questions, any concerns in regard to medication administration, they must be directed to your team leader or the relevant medical professional, such as the pharmacist. If you have any concerns with what you're doing, the participant's reaction to medication, it must be recorded and it must be reported. Thank you.